Hello, everyone. My name is Trevor Smith Miller. I am the Communications Manager for the Canadian Cancer Survivor Network. Thank you to everyone for attending today's webinar. This is the final talk of our 2025 webinar season. If you're new to our webinars, a little background on our group. CCSN works to connect patients, survivors, and other stakeholder groups with decision makers and the wider community to engage in discussion and to act on evidence-based best practices to alleviate the medical, emotional, financials, and social costs of cancer. To learn more, visit survivornet.ca. This webinar is being recorded and will be available on YouTube, and a link will be provided by the email you registered with, along with a link to the slide provided with this presentation. We'll have a quick Q&A session at the end, but if you'd like, please put your questions in the Zoom chat at the bottom of the screen. Now, this webinar was made possible by with grants from AbbVie, Amgen, Astellas, AstraZeneca, Eisai, Bristol Myers Squibb, Janssen, and Merck. It is because of their continued support that we can host the CCSN webinar series and thank them for their commitment to our educational endeavors. Now I'd like to introduce a couple that needs no introduction, but I'm going to do so anyway. We have Dr. Rob Rutledge. He is a radiation oncologist in Halifax, Nova Scotia, specializing in breast, prostate, and pediatric cancers, and is an associate professor at the Faculty of Medicine at Dalhousie University. His passion is empowering people affected by cancer and has delivered hundreds of public talks and webinars, including with CCSN, along with over 60 retreats and day-long seminars to thousands of cancer survivors. Rob has received a Cancer Care Nova Scotia Award for Excellence in Patient Care, and Doctors Nova Scotia presented him with a Health Promotion Award in recognition of his contribution to physician health and health promotion in cancer patients. We also have Dr. Gabriela Illy from Dalhousie Faculty of Medicine, endowed scientist in prostate cancer quality of life, and an associate professor in the departments of community health and epidemiology, urology, radiation oncology, and psychology, and neuroscience at Dalhousie University. She is an affiliated science with Nova Scotia Health Authority, Queen Elizabeth II Health Sciences Center, and scientist with the Beatrice Cancer Research Institute. Gabriela initiated the leads with the PC PEP, Cancer PEP, and now Pictou County PEP programs and the scientific and clinical teams behind these programs. Dr. Illy has an established track record of publications with 99 papers, which have a combined 49,000 plus lifetime citations. Now, Dr. Illy and Dr. Rutledge co-lead Cancer PEP, a research-proven 6-month daily home-based patient empowerment program. This wellness program helps patients take control of their physical and mental health and build resilience by daily participation that incorporates fitness, nutrition, mindset, relationships, and more. Visit cancerpep.org to learn more, or if you are a prostate cancer patient, visit pcpep.org. And so, without any further ado, I'd like to hand it over to the good doctors for their talk, Meditation and Visualization after a Cancer Diagnosis.
Wonderful. Thank you so much, Trevor. It's a real pleasure to be able to work with CCSN. And thank you all to those who are attending now and those who will attend and watch this afterwards. You're making a huge difference in your health, no doubt about it.
Yes, and I think today's talk is also quite serendipitous, as tomorrow is the International Breathing Day. And since breathing gets part of meditation,
yeah,
I think it's very serendipitous. Apropos.
Yeah, and I think that we talk about all the ways that we can empower ourselves, and we forget about this kind of relaxation technique, meditation technique has a tremendous influence on our health. And so I want to make sure people recognize that, and it is part of the healing program, part of the recovery program. This is what we're going to talk about, the fact that you can continue to change your brain throughout your lifetime. We'll talk about some relaxation techniques, meditation techniques, how it is that these techniques actually change your brain for the good, so you can be healthier and happier in the long term. And I'll even do a little bit of a visualization at the end of it. And I'm really lucky to be sitting beside my wife, because this will be kind of interactive, kind of question-based. So I'm hoping this is entertaining and helpful.
Yeah, what we really like about this, that we've been doing this type of work integrated in the programs that we deliver for cancer patients, the patient empowerment programs, and you get to learn a lot. On a monthly basis, we have to update the science. We want to update the science behind our program. So since 2019, we've been holding those live monthly video conferences. And in the process, you get to learn the good, the bad, the in between. There is a positive, wonderful aspect to meditation. And we'll be talking about that. There are some negative sides to meditation. We'll be talking about that too. And something really wonderful emerges when you understand, what works for whom, under
Mm,
what conditions, because then you're less harder on yourself when you
yes.
decide to sit for a meditation and nothing really happens because your chattering mind comes in and it disturbs the process. And then the
Yeah.
question is, what am I doing wrong? And so to understand what happens, when can we meditate, when
Yes.
meditation doesn't quite work,
Yes.
what interferes with it, what are the ideal conditions, I think it really empowers us and it
Yeah.
takes the sting of guilt or questioning
Self-judgment. Yeah.
self-judgment that maybe I'm not doing something right. Maybe this is for really advanced spiritual people, not for me.
And I really love that point. Is like use what works for you, right?
Mm.
So no, not every technique is going to be appropriate for yourself. So you kind of figure out what feels good, what makes you feel better in the long term. So I really love your point of, individualizing. So then I ask that person, they get a cancer diagnosis. What do they want? Ultimately, what do people want after they get a cancer diagnosis? So what's the big one?
Yeah. Want to live longer.
Yeah.
Want to live.
So they want to be either cured of the cancer, or if that's not possible, they want to live for decades, right?
Mhm.
So, and every aspect of the program that we offer, and even including meditation, relaxation, contributes to that because it does boost immune function and lots of other ways you can get through your treatment more easy. So people want to be cured. What's the next thing that people want, just generally even speaking?
To be able to continue to live their life's purpose, do things
Yes.
without the stress of having to wait, worry, and waste
Yeah.
just because they got a cancer diagnosis and put everything on hold.
Yeah.
They want to be able to interact and,
Yes.
with the loved ones
Yeah.
in a more or less normal way, maybe even inspire, maybe even better way.
And you know what? I like that because I think about we do all these things. We
Mhm.
exercise, we have a good diet, practice a relaxation technique, stress reduction, however you want to put it together. But ultimately, that's all to serve a bigger purpose. And the bigger purpose is what you're talking about is like, how do I want to live my life? Do I want to connect more, et cetera, et cetera. I put that as number 4 because you kind of went to you went to the heart of it. The second thing I think people want is they want to feel better,
Yeah.
right? So it's stressful and it's just not enjoyable to feel stressed and upset and anxious and depressed. Like those things are difficult things for us humans, right?
And also think better. You want to make the right
Yes,
decisions,
there it
right?
is.
Oh,
Have more energy and think more clearly. Actually, I should have put down think more clearly, but really it's like energy, function. You want to be able to do things
yeah.
in service of the bigger picture, which is if I have those things, then I can connect more deeply with life, spirit, more deeply with friends, family, right? This is about purpose. So we think about this and think it's in service of that greater thing. Meditation, relaxation is in service of a bigger thing, right? We don't become good meditators, just become good meditators. It's helpful. And I'm thinking about kind of every aspect of a cancer diagnosis, including going into the medical system, including dealing with the emotions, including dealing with loved ones and friends and how they react. Every aspect of that does take that kind of perception and kind of cognitive ability and mindfulness to be able to do it as good as possible for you in that sort of sense. Okay, so integrative medical care, or integrative cancer care, or what I call complete cancer care, you're doing everything within what the medical system wants you to do, like getting your best care from the medical system, and then empowering yourselves body, mind, and spirit. So it's that kind of integration combination that gives you the best chance of achieving those goals. So big picture, there's the understanding slash empowerment piece. What can I do within and without of the medical system to really improve? There's the kind of knowledge and skill set and attitude of how you interact with the medical system to get the best care. And then we think about it superficially as body. How is it that I can energize, help my body recover, get a better immune function, et cetera, et cetera. And there's all this kind of teaching and things you can do to work towards that. You're not going to do it perfectly, but you can slowly integrate those healthy habits into your life and be stronger and happier. And then I think about healing at the level of the mind. The mind is very powerful in terms of what we can focus on, what we can't. And this is really where we're getting into the relaxation meditation part of this. And then also kind of nurturing a spiritual perspective, however that is best for you, which can kind of transcend, many of these elements here.
Yeah, it's interesting because you're tapping into this integration, this, adapting to the current present situation. And Jean Piaget, developmental psychologist, kept saying that growth happens once you arrive, you land on things, you accept, you adapt to things. And once you've done that, you can go on to the next step of growth. And we grow all the time, right? But landing there, and that's what you're talking about. It's super important. And meditation really helps with that because it makes me reflect on what's happening here. What changes do I need to make, if any? What changes do I need so that I feel better, I can cope better, and I can be the best version of myself.
Nice. Love it. So, big picture for all of you, think about this question. What kind of person do you want to be? I'll kind of restate this. What are the mental states, the emotional states that you want to be in more often? So I'll ask you that one. Like, how do you want to be?
This presence, being in the so-called present moment, and a few things do that in our life when you stand and think about it. Scientists have been very curious. What almost drag people in the present moment without even them thinking about it? Number one is sex. Yes, you heard right. When you have an orgasm, actually, you're very much in the present moment. Another one is when you love and you respond lovingly, spontaneously, fully to another person and you're really happy. That's again when you're in the present moment. Another one is when you're sad, when you hear something that is really
your heart.
And that kind of right away wakes you up to immediately what's happening.
And I'd say, I would identify, you said at least one thing is to be more loving, more peaceful. I'd rather be more peaceful, clear-minded, staying in the present moment, so we can actually practice those states of mind. And whatever you practice, your brain gets better at. So if we become...
This is not to say you have to... This is not to say you have to have sex to be the best.
No.
Just wanted to clarify.
I guess the point is you can think about it, well said. You can think about it as, no, I want to be more calm. I want to be more caring. I want to be more centered. And so I'm
peace of mind. It's a great commodity.
Yeah. And so I can practice that. And when I get off course, I come back and I practice it. Because the alternative is to be like,
everywhere.
Every little fluster, the track's not right. And so then your brain, there's all the, what I call the circuitry, the stress circuitry gets very strong. And so that's what you practice being all the time. Or you can practice this neurocircuitry. Okay. Clean, like my shoulders are now going to drop a little bit. I don't have to have my shoulders to the ears all the time, right? And then that neurocircuitry gets stronger. This one starts to fade. So we're doing that continuously throughout our lifetime.
And cancer diagnosis or not, honest to goodness, none of us really want to wake up every morning thinking, I need to put out a few fires.
Right.
What kind of life is that where I constantly spend my energy on fight or flight, what fire do I need to put out? It's impossible for me to be creative if I don't land, if I don't meditate, if I don't come to the present moment, if I don't come back to center and to some sort of peacefulness or some sort of a breathing space where I can say, wait a minute here, I have a mind that can change it.
Yes, there's possibility. I guess that's the take. If you practice those states, then they become more like personality traits. Right. So we can do that. We can practice that with time. And I also want to say, look, we're human, right? This is not like being like, you have to be Zen all the time, like in perfect calmness all the time. To recognize.
That'd be nice, but we not sure how practical.
We kind of fluster, right? We flip our lids and then we can recenter. So it's kind of sensed back and forth throughout the day, back and forth, good days, bad days, et cetera, et cetera. So I'm not trying to say you have to do it one way or the other. But like lifting weights, neurocircuitry goes down, and then the stimulus gets associated with the output, which is the calm state, and you wire your neurocircuitry, right? So it almost becomes, life becomes more like a ritual,
Mhm.
right? So I'm walking, I'm practicing my meditation in the morning, et cetera, et cetera. So,
And that's why you hear oftentimes that people take time off and they go someplace, like
mm,
spend some time in nature, perhaps with a
right.
guru or some sort of teacher that walks them through the practice of meditation and breathing. And it's wonderful because you practice that technique, you rewire your brain, and then just when you think, okay, you know what, I can do this. Can I be the teacher? The guru says, well,
Bring your family in.
how about you go back to your family? How about you
Yeah.
fly back to New York,
Yeah.
back to Toronto, back to where you came from, and try to apply those in the day-to-day basis. And
Yeah.
that's when the rubber meets the road.
Right. And we're not going to do it perfectly. Okay, so then the other one, I want to kind of push you towards this idea of, if you want to be more calm,
Mhm.
you want to kind of experience less stress, because I think that's better for you both in terms of
Yeah.
your immune function and your psyche, and you're being able to connect with others. So if we want to do that, what are the kind of levels or steps? And the first thing I'd say is to actually practice it as a
Mhm.
routine. So you and I, most
Yeah.
mornings, 10 minutes, sometimes we use our little biofeedback
Heart rate
monitor
variability monitor.
and we practice that.
Mhm.
And recently I've been working on allowing my shoulders to drop. My blood pressure is kind of running on the higher end of things. And I know I'm kind of throughout the day kind of holding that tension. And so now I'm thinking to myself, as I'm practicing the meditation, long, slow, smooth out breath. Allow those shoulders to drop. So as you're listening to this, like we're going to be doing a lot of this stuff. As you're listening to this talk, please kind of participate, kind of live the talk, so to speak. So allowing the shoulders to relax. And what I call that is resetting your stressometer, because then my stressometer is down lower and I'm hopefully going to be able to maintain that more through the day. The other thing is I think of it as a wellspring. You created some neurocircuitry that is more calm. And then, okay, something flusters me. I can go back to being calm because I have this kind of well of a resource, a treasure trove of a resource there. So I think it's actually really important, that by itself. So that's, go
I
ahead.
love this. I actually was talking about living this. You didn't share this with me. He meditate every morning, but he's not sharing all his secrets with me. And that was really good, wasn't it? I'm not sure if you tried it, but I was trying it while he was talking, and I'm like, this is working. And then my mind goes, oh, allow those shoulders to drop. Oh, that feels so good.
Yeah.
Great technique.
Wow.
Write a book about this.
Yeah, exactly.
Honest to goodness, I'm not
We'll
joking.
practice it more,
No,
I
it's
guess,
wonderful.
is the takeaway.
Incredible how much tension we hold
Yes.
in our
Like
in
that's
our
me
shoulders, and we don't
walking
even
through my
realize.
day, shoulders to my
Yeah,
ears, like, no,
that's
okay,
me too.
just settle. So the second level is mindfulness, and is part of the meditation process, to be able to watch yourself throughout the day. Oh, I'm getting myself upset and flustered here. It's actually not necessary. I can settle down, right?
I can see peace instead
Instead
of
of
this.
this, yes. Coming back home. And then you get better. That muscle of returning, recognizing and returning, like meditation itself, also gets stronger, right? So that's the second level. The next level is to recognize that you can reframe stress or the external circumstance as potentially helpful, right? So you see this circumstance come out, you see going into my medical appointment or something like that, I'm feeling stressed. And you can, instead of saying, I shouldn't feel stressed, this is awful, I need to settle down, you can say, something important's at stake. I can use this energy to focus my attention during this visit so I get the best visit from my doctor.
Something important is at stake. You just brought our attention on something I think is so important. Meditation is not about denial. In fact, this is one of its negative uses. And I think it's very important. The house is burning. I'm going into an appointment. I need to have a clear action plan. I need to bring somebody in with me. I will be too overwhelmed. I won't remember a thing. And I will forget to say things and so on. So something important is at stake. So this is not about, denial. I think, and you brought that up just now, and I think it's such an important point, Rob.
Yeah.
Because
100%.
that would be a particularly unworthy form of denial.
Right. Because we are human. We also want to
Mm.
just be very pragmatic. I'm going to be anxious in the doctor's office. That's been my experience
Yeah.
so far, despite all my meditation for decades.
And it's normal.
It's normal. And so maybe I should bring somebody along with me and have a
Mhm.
plan like you capture the notes and I'll try to focus on my doc.
Yeah.
And if
Yeah.
I don't ask these questions, I mean my list of questions here, then you make sure so you're being smart about this,
Yeah.
right? And essentially you can just say it's stressful. I can use the stress to help myself. So that's the reframing of the relationship. And lastly, it's a bigger, I'd almost put it in kind of the spiritual side of things, is to recognize we've created a virtual reality. We've created a virtual world. There's kind of virtual relationships, virtual ways we look at how other people think about us. So it's, in some sense, is malleable,
Mhm.
and that we can reframe those core beliefs. We can, quotes, let go of the little stuff or the small stuff, right? And then you're really starting to say, it's not worth me being flustered
Mhm.
about that.
That's wisdom.
Right. So that's it. So then
Right.
you're
Yeah.
really, the water's going off the duck's back, because that just doesn't matter. That does not matter what people think or what people say, even blah, 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 blah. And obviously in some circumstances, but
Yeah.
just like let that one go, focus on what I can do.
And you're talking about almost a rite of passage. It's harder
Hmm.
not to be caught in the weeds when you're young and you have
Yeah.
kids, and you know how it
Yes.
is.
Yeah.
You're being pulled by finances, by this,
Yeah.
by that, by
Yes.
relationships, by kids' needs, your needs. So it's much harder to appreciate the wise argument,
Hmm.
you know,
Hmm.
of let me have more of an eagle eye rather than being
Yes.
stuck on this piece of the puzzle and lose sight of the bigger picture.
Yeah.
What is the bigger picture? Okay, well, the bigger picture is that the house, I'm not going to remember 10 years from now that the house was unclean, that I didn't do ABC chores,
Mm.
but I will remember whether my daughter or my son was at my chest and we were
Mm.
connecting and sharing deeply from the
Mm.
heart. So you were talking about almost like a rite of passage.
Right.
And I can only reflect now as an older woman myself
Right.
about
Prioritization.
change over the years, and we all become a little wiser.
Wiser. Yeah.
We grow on this spiritual journey. We graduate certain lessons, like the being in the weeds, and the weeds is everything.
Mm.
To wait a minute. Oh, well, maybe not.
Yeah.
There's a bigger picture.
Yeah. I mean, and it's practical things like you can't control other
Mm.
people's behavior, right? It's super hard to do. So what can we focus on? So that's and when you take that power back, I'm going to play the game so I can win, is how I think about it. Like, how can I influence what my behavior is and how I interact with other people, recognizing, yes, empowerment again. So,
Yeah.
okay. So I also want to kind of, recognize, as I was talking about allowing the shoulders to relax, like the long, slow out breath. When the body relaxes, it sends a signal up to the brain to say, I'm safe. And so you can actually try this. It's kind of slumping in your chair, looking down, where it's kind of eyes slightly closed or closed, and maybe even pretending you're like chewing gum, and just let everything flop. Okay, so you can come back to looking up and so on. But as you did that, the body is saying, I'm not in a stressful
I
situation.
agree.
Yes. Which is, because
This works.
typically if you're stressed, then the posture's up and the eyes are wide open and you're, in that mode.
Yeah.
So it's what I call body up.
Body up. I like that.
And your gut, it's the same thing. You have essentially the two brains. You have the kind of gut brain, you have your in your head brain, nervous system, et cetera, et cetera. If you can take care of your gut, it also sends signals up to your brain to say you're good too. So it's not quite the same, but I just want to let you know, like, it's not just this brain dominating this, it actually goes both ways. And so I'm going to ask you then, what are the ways in which you can have your body relax? What are the activities where you can trick your body into going like, oh, that feels really good.
Touch.
Yes, good for you.
Touch.
Yeah. So we can
Touch.
hug
Oh,
for
yeah.
certain,
Oh, that's
and
it.
hugging for a
That works.
longer period of time. But you can also, and you can ask for a hug from a
Yeah.
loved one, right? Or a back rub, etc.
Pick up your animal.
You're,
We have a little kitten here, okay? We just acquired a new kitten. You have no idea.
he's making lots of noise.
Talking about body up.
There.
Look at this.
That
She broke the cuteness scale.
is right.
She broke the cuteness scale.
Yeah.
So one hug from little love and
Well,
I'm
you can also
a puddle.
pet your pet, right?
Yeah.
But I also think if you're living alone, how would you do that as well?
Oh, yeah.
Watching a professional golfer recently do the same thing.
Mm-hmm.
She is just wreaking havoc here. Yeah, so
Yeah.
right?
Oh, yeah.
Your body knows that. Okay, so how else? What are the other
So touch is one.
activities?
Listening to music.
Yes.
Sing music.
Right.
Yeah.
Music hits and relaxes.
Today I drove all the way to Eastern Passage to look at the water. That does it for me too.
There it is.
Yeah.
Being into nature, scene, aromatherapy.
Oh, yes.
How about this one?
Yes.
Relaxation. There's a progressive muscle relaxation technique because typically we think let the shoulders drop, right? So that would be a passive relaxation. It works for me,
Oh,
but we can actually do something together. So
Okay.
again, you're participating.
yes.
And according to your ability, don't hurt your muscles,
Yeah.
your bones, so on. But bring your attention into squeezing your hands and forearms like at the level of the elbows as hard as you can for about 5 seconds. Bring your attention there, and relax. And then continue to watch where the tension is within that area. Okay, second one. Shoulders, scrunching your face. You can still clench your hands hard. Again, don't hurt yourself. Hard. And then relax again. Yeah. So again, you're feeling the contrast between tension and relaxation. Lastly, squeezing the legs, the buttocks, the knees, pushing it together, like you squeeze your butt cheeks. 3, 4, 5, and relax, right? Oh. Someone's been working pretty hard here, so she's enjoying the relaxation. The takeaway is
Bed.
Exactly. Lie down.
Exactly.
You can go through a guided relaxation technique there. The deep breathing, we've been doing a little bit already. Long, can do it with me now. Long, slow, smooth out breath. Nice. Slightly bigger in breath. And out. Slow, smooth out breath, allowing your body to relax as you're doing that. And again,
You can do the box meditation.
So breathing in for 4, 2, 3, 4. Hold for 2, 3, 4. Breathe out for 2, 3, 4. Breathe in for 2. Sorry, hold for 2, 3, 4. So I got this wrong. In, hold for 4. Breathe out for 4. And hold
for 4.
Yeah.
And of course, you can increase that. I love to breathe deeply, and then I like the 8, the same box meditation, but for 8. And sometimes the breathing out is a little longer. I was participating in a student defense today on lung capacity and how that drops after a certain age. We're young. And just how important deep breathing is. You think, oh, just for my lungs, but no, actually for your whole body.
Right.
It's super important.
There it is.
To get fresh air, important to be mindful of gases and so on. Especially we all live in houses that, the house's foundation, even new houses have radon, and how the importance of opening the windows.
Letting the air.
Yeah, super, super.
When you can, especially during the winter.
Even in the winter.
So other ways that you got, so music therapy, aromatherapy.
Love it.
Right? Again, a warm bath. For those of you who have touch as your primary love language, and I'm one of them, like taking a warm shower, I find very pleasurable. Massage machine. Again, I'm trying to do this as what the individual can do, and there's a little bit massage machine, you can press your back against it and so on. So body up. Relaxing the body relaxes the brain. Okay, so we're going to move into meditation. And the idea is there's a lot of different capacities that meditation can help build over time. And meditation, as you're practicing this, so as I talk about meditation, like for instance, if you just practice attention on the breath, breathing in and long, slow, smooth out breath. And yes, my mind is going to chatter. I'm going to bring my attention back into the same in breath, out breath. So it's just this kind of repetitive technique focusing on the breath. So that's an example of meditation. And even doing that changes the brain. Again, you're practicing a relaxation technique which changes the brain, allows us to regulate our emotions. I'll show you the hand model of the brain. So the wrist is the spinal cord, and the base of the thumb is the brain stem. It's the primitive brain of the reptilian brain, like very much an unconscious brain. And the thumb itself is what I call the irritable brain. It's the brain that actually is like the stress brain. And then over top of that, through human evolution, is the frontal lobe. And the frontal lobes, as we're practicing meditation, you can see that they're sitting on top of the stress brain. They're like regulating or dampening down the stress reactions. Like, it's okay, little buddy, I got you, type thing. So, and what happens with us is we get stressed and we flip our lids, stressed until you're thinking out of your stress brain. And then we come back to center, that kind of wise, compassionate, loving, logical, social brain on top of that. So that's one of the reasons why practicing meditation actually preferentially increases the neurocircuitry in the left prefrontal lobe, which actually sits on top of the emotional center. So
yes, it decreases that activity in the emotional center.
Yeah. Improved focus, right? So you're practicing that attention. It's a skill that gets better with time. And then if you're living out of your frontal brain, the best version of yourself, then the stress pathways, the anxious pathways aren't as strong. You're less stress reactive. So there's the alarm bell of the brain called the amygdala. And it's necessary, right? It detects threats and it's kind of on alert all the time to keep yourself protected from, getting hit on the street by a car or
stressors or threats from your past or that are encoded throughout the body. We call them the power of the unconscious emotions. So something happened to you when you were a little girl, little boy, you were attacked on the street that had certain characteristics. Now you're a grown-up person. There's no issue. But if you find yourself in that same context, the body will react, will say, hey, uh-oh, I've been here before. And you say, funny, I feel like something is the matter, but there's nothing the matter. And those are the unconscious emotions. And they have a lot to do with the amygdala.
Yes. Yeah.
But those unconscious emotions, as Candace Pert said, they are encoded throughout the body. So it's not just the amygdala. The amygdala acts more or less as a hub.
Yeah, it is a
control hub.
Central hub.
Yeah.
And I found this diagram on the right-hand side very interesting. So you get in the kind of frustration state. It shouldn't be this way. And that's the amygdala is going like giving that wiring throughout your brain. Same thing with anger, the kind of seeing red, wanting to throw the computer screen out or whatever. Also, a neurosis where you're kind of looping through something that might be unreasonable, for instance. And lastly, I find this fascinating is apathy.
Oh, yeah.
Right? Because then it's almost like
flat affect.
Flat.
Nothing really gets to you.
Yeah.
Like you're some sort of machine or something, or you're just
nothing's
like your system has been switched off.
Yeah, the wire is completely down. So, but you need these aspects of your brain. You need the irritable brain that gets you off the couch, right? The dopamine part of the brain. You also probably need your amygdala as well, because otherwise you'd be apathetic.
Yeah.
So it's funny. It's like keeping yourself in that kind of middle ground.
Oh, yeah.
So I just found that really interesting. See, that's all related to the amygdala. As we're practicing, though, we become less reactive, right? If we're in a more calm state more often, then things are less threatening. and the actual size and the neurocircuitry of that area of our brain actually reduces with time, which I find fascinating. I was talking about the left prefrontal lobe of the brain. That's your, what they call the CEO of the brain, logical thinking, impulse control, right? There's the there's the fight or flight, but there's also the rest and digest. There's pause and plan, right? You get that impulse to, say something or to your boss or whatever, so you have that kind of oversight and the emotional regulation. Oh, there's that emotion coming up. Okay, it's not worth it. Like, let's be clear here. What's most important in this circumstance, and been able to kind of override that. So it's okay, little buddy.
This is so interesting because you know, what's happening in our environment really affects our brain. So for the longest time, we thought that we go from the amygdala brain, the limbic brain, the emotional brain to the frontal lobe. That's how our teenagers, graduate from that. And we all know that emotional brain into being an adult, meaning they move from the emotional to the frontal lobe. But now there's more evidence to show that the exact timing in one's life where we transition from being more in the emotional into the frontal lobe is much later.
Especially
in fact, it's
in men.
more especially in men.
Late 20s, yeah.
Late 20s, 30s now. So it's very interesting to see how evolution or our environments, our ecosystems affect brain development and so on. So yes, the more you practice, but there's some other, the system itself the process that can explain, more peace of mind versus the absence of it is a little more complex.
Yes.
It does have to do something with the environment and the stressors that we're exposed to.
Yeah.
By and large, you can control the amount of frontal lobe processing if you're a normal individual, meaning if there's no illness of some sort or chemical imbalance of some sort, you can, through the process of meditation, you will be living more in the frontal lobe. There will be much more. So the driver, the puppeteer will be more in the frontal lobe than in the back seat in the emotional brain.
Yeah.
So
Love
very,
it.
very true. Provided all is normal, provided that they're not outside circumstances.
Agreed. And then you're really talking about degrees. Like this is not an all it's like more complex.
Yeah.
Interesting that the left frontal lobe is associated with positive emotions. The right frontal lobe is associated with negative emotion. It's kind of the balance between the two sides. And that's partly why I think meditation helps with emotional control and regulation, because it's empowering the left side. Okay. What is the default mode network? So the question is, if you're just like walking down the street where don't have anything particular that you're supposed to be doing, or just kind of puttering around the house, maybe taking a shower, what if your mind is left to its own devices, what do you think about? That's called the default mode network.
Well, it depends.
My husband should be cleaning the house more.
Yes. Aside from that,
that's the
deadlines and so on, most likely the thought of getting back to work, attending to that deadline would intrude. But I'd say if there are no deadlines and my husband has cleaned the dishes, I'd say my mind goes into creative mode.
Okay, so you're lucky. You go into creative mode. Most people are kind of ruminating around the me stuff. What do I need to
Well, that's no exception. Don't listen to him. I'm just a
yeah.
My mind too goes into the me stuff.
Well, the me stuff is, do I have a deadline? Yeah. What happened yesterday? What should I have said when those guys said that to me?
Yeah.
So it's what I call the me movie. Right? It's all about me.
Absolutely.
Thoughts
for
that
all of us, yes.
That revolve around myself, how I relate to the world, how I relate to other people, how people perceive me. And I know this because it's what I would call kind of like the chattering minds, kind of thinking about this, thinking about this.
But the creative mind is also the me stuff.
Well, yeah.
Because I'm thinking creatively, what can I do for myself?
What can I do for me? That's what you're saying. Yeah. Maybe
it's a spa. Can I call somebody to book in a massage?
Yes. Me. The me movie.
Oh, there you go.
And so you're thinking around the cancer diagnosis as well. What's going to happen to me? And so I'm not saying this is a bad thing. All I can say is that when we're in a more relaxed, positive state, then we can worry less about what other people think about us, less about what's going to happen in the future,
Yes.
and more about actually being present. Right. So right now, you and I are very, very present with each other, right? As opposed to kind of a scattered mind, we actually can pay attention to our loved ones and connect with our kittens and everybody else. So when that's
That's why I
over,
was smiling when you were saying that, because there she is sitting in our lap. It's so beautiful.
right? And so less around this kind of scattered, chattering mind, which is the me movie and all the implications of me, and more about, okay, let's just enjoy life. Let's be connecting with life. Let's connect with other people. So I know, because I know coming out of meditation, I have more of that feeling. And then as the day goes on, I get more into the default mode network. So I can see myself. I'm watching myself think throughout the
And
day.
that's normal too. And another thing that we're doing and part of the program, because we're very transparent in our program. So we talk about this and we normalize it. We prescribe, describe it, and demonstrate we're normal people too. I think even saying that to your partner, if I communicate that to Rob, look, I'm a little more irritated. It's the end of the day. This is not about you. Please forgive me. This is sorry. I'm not quite paying attention to you. I'm a little irritated. It's nothing to do with you. And that's good because that lets him off the hook, that he doesn't have to think, oh my gosh, she's angry at me. I didn't put the dishes in the dishwasher or or whatever. This is just an example. But it's so important to communicate. And you get in that habit, and that really teaches the other person to communicate. So all of a sudden there's less desire and impetus to be triggered to be just looking for trouble, or judgmental, or just in that fear kind of mistrust state where you think, like the me world is going to win here. It's all about me. I've done something. He's upset, or she's done something.
Well, and also it also starts with mindfulness, being able to watch your own thoughts, be able to watch your own emotions. It's the other huge benefit. So meditation also lowers cortisol levels.
That's key.
Cortisol is the stress hormone. So it's coming out of the kind of main hormone system within your brain down to your adrenal glands, which is setting out this cortisol, which is kind of setting up the inflammatory processes, raising the blood sugars, lots of stuff. And you can kind of see in the diagram there, right?
Yes.
Not only does it have a physical effect, but it also, that cortisol, that chemical that's in and around your brain, is also changing how you think.
Right on top of your kidneys there. Isn't that interesting?
Yeah. And if we allow ourselves, and if it happens that we are just like anxious for a long period of time, interestingly, the body kind of shuts itself down, can easily flip into the chronic depression side of things. We can't think as clearly when the kind of stress levels are right. So you're flipping your lid, you're no longer engaging your frontal lobe, and then the irritable brain is doing the thinking, and it can't think as clearly. So the brain fog, memory problems, et cetera, et cetera. So cortisol kind of eating away at the tissue. So if we can stay more balanced, less cortisol in the system, our body is healthier, and we can think better.
Better kidney function too.
Yeah, all the above.
Yeah.
So this is interesting then. So far we've been just generally talking about a little bit of mindfulness meditation, but there are different types of meditation, and each type of meditation can influence a different part of the brain and have different benefits. So I'm just going to take us quickly through that kind of idea. And so you choose the technique that you need further. And we've generally broke ourselves down into focused attention, which is good. Open monitoring is more like mindfulness. Constructive meditation, and we'll take you through more examples, is actually building some positive core beliefs. And then deconstructive meditation is to kind of let go of kind of the ego sense of self and kind of see a bigger perspective. So there are different ways to kind of to look at this. Oh, I forgot to say that by practicing meditation, there are lots of different ways to measure our stress levels. And one of them is called heart rate variability. When we're stressed, we get kind of stuck in this kind of, and there's not much variation in our heart rate. When we're more relaxed, when we breathe in, our heart speeds up. When we breathe out, our heart slows down. And so that kind of variation is actually healthy and helpful.
And it's a wonderful measure because you can't just say to yourself, "Oh, I'm meditating, I'm breathing." It's like going to church and really not believing in the prayer, or not, your heart not being in the prayer. What the heart rate variability does, and the biofeedback, it really shows you how your physiological activity is like when and it's, you can't lie. The body doesn't lie.
Yeah, there it is.
So me just saying, "Oh yeah, I'm so meditating right now. This is it. I'm doing this." It's not gonna work.
Yeah.
Until you actually do it, until you let your shoulders drop, until
Yes.
you
And
start breathing, when you really start letting go, when you really settle down,
Very
that you
sweet.
see an actual picture of the body saying, I can really relax now.
So you can use a focused meditation. And when you really focus and pay attention, there's actually different neurochemistries, the different chemicals within your brain that gets releasing. Dopamine is actually a really good one because it's the get a job done, feeling a sense of accomplishment.
Yes, and serotonin. I mean, you meditate and serotonin floods your body, another happy hormone.
Yeah.
The other two are oxytocin when you hug somebody. So you could actually get dopamine, serotonin, and oxytocin all in one go, especially if you touch yourself, right? You can do
Nice.
that, or touch somebody else, like the little creature or person next to you.
So attention, being able to focus on what's actually happening in the here and now. Also, memory. You access better memory when you're actually able to focus, for instance. How do you practice this? Obviously, there needs to be an object. We've been talking about the breath and recognizing. I'll give you a quick example of what my meditation experience has been for, geez, it's like almost 30 years of meditation. I'm breathing for 3 or 4 seconds, and then my mind is starting to think about what I need to do that day, et cetera, et cetera. And at some point, I recognize, actually, I'm not focusing on my breathing, bring my attention back. And then a few seconds after that, I'm thinking about what happened yesterday, and that was a stupid thing to do, and why did I do that? And then at some point, I get caught up in that, and then I bring my attention back, breathing, and then I'm back and forth. And this has happened, for 30 years almost. Now, luckily, I do kind of get a relaxation feeling, and that chattering mind doesn't seem as loud. I don't get caught up in it. Doesn't have the same emotional punch as previous.
And probably your time that it takes you to get from that to that.
Coming back again.
It's getting shorter, doesn't it? It's as if now you can control it much better. Whereas before you would say, "Come on, let's calm down." And
it could be a long time. Right. I'm stuck in this, right? And again, this is not about getting better necessarily at any of that. All to say that watching that and the muscle of returning is very helpful. And so you focus, your mind's going to wander, you bring it back, and it's just like that muscle gets stronger and stronger. And really, I think it's helpful. It's certainly helped me, I guess, is the way. And what they're saying is, again, it's that left prefrontal lobe, attention, impulse control. And I think our brains can function better. So we have better cognitive function when we do that. Next level of meditation is mindfulness. So it's like less about focusing and just watching. It's what I call observer consciousness, is like watching my thoughts, watching my emotions. I think it's easier and better to focus on something because I can focus on something and I can watch those thoughts and emotions come up. So I think it's a kind of a 2-for-1 deal in that way. So that's kind of pure mindfulness. What they're saying is, again, emotional regulation. There's the center of the emotions. We can dampen that down. And you can still feel sad at times or upset at times, et cetera, but you can let go of the unnecessary stuff more easily. Calms the amygdala, the kind of brain's fear center. This is good.
The dark side of mindfulness. Yeah. So, scientists have been curious as to see for what percentage of the population mindfulness works, and it brings positive results. And for the great majority of our population, it does work. So does prayer. And when you think about it, most people on this planet believe in something greater than ourselves. So that's a big deal. However, 8% or more now, those statistics are now about 15 years old, but 8% of people can have a negative experience associated with mindfulness. So I say, well, how come? Well, sometimes mindfulness brings feelings of anxiety, panic attacks, or depression, and that can particularly be the case when people are being trained by non-experienced teachers that don't take context into account. I mean, I have a cancer diagnosis, and right now something really important is happening. I need to deal with this disease, and you're asking me to pretend it's not there, it's not happening. So that form of denial can bring alongside with it a lot of anxiety and panic and so on. So there is a context there, right? So if the teacher is not trained enough, doesn't have enough life experience, or simply is not mindful themselves,
Agreed, yeah.
it can lead to this. So watch the teacher. Dissociation, psychosis, again, usually associated with denial. There are some practical things there, sometimes that are known, like a cancer diagnosis. Perhaps the group might know you have cancer, but what if, we're looking at rape or some very deep trauma that is not necessarily shared with the group. So now you're asking the individual to kind of dissociate to something very traumatic that they're still processing and trying to understand and make sense of. That can lead to dissociation, psychosis, depersonalization, derealization, trauma re-experiencing. That can also happen as a result of mindful meditation when you don't address the reason for panic or negative emotions as they surface in the process of meditation. You could re-experience being, okay, it doesn't matter. Here I am with a teacher meditating, and they're not acknowledging the fact that something terrible has happened to me.
Sure.
And I'm still shocked at the fact that I got a diagnosis. That's trauma. Nobody cares. That's a trauma re-experiencing kind of event. And then there could be cognitive, somatic issues like disorganized thinking. What is going on? What's reality? What matters? I'm confused. You know what I mean? Memory impairment, perceptual hypersensitivity, physical issues like sleep disruption, gastrointestinal problems, right? All related to being ignorant of very palpable, very real thing to the individual that are happening, and all of a sudden, deciding to push them away without the proper training, without the proper contextualization of that. Because you could say, okay, imagine that we could be living in a virtual reality, but that's different. That is a make-believe rather than you telling me none of this exists. So you're asking me to deny my that's a particularly unworthy form of denial, right? So we need a well-trained teacher who can recognize and manage these issues. And then, of course, there are the societal and ethical issues. You probably heard quite a bit of money have been made out of this mindfulness concept. And some have argued that when we commercialize meditation and this kind of type of growth and this type of self-training so that we can live a more peaceful life and make rational decisions and also be gentle with ourselves. But we can take this out of context, and instead of treating it a little bit sacred for what it is, and all of a sudden we make it commercial, then we end up with some of the problems I just mentioned. So it has been criticized that the whole concept has been commercialized to such an extent that the very process itself has been altered, and it can really harm people. Shifting blame to the individual. Nothing really is happening. You got cancer. Let's calm down. Let's bring peace here, as if this wasn't a big deal. Well, it is a big deal to me. It's a big deal to you. It's a big deal. And not fixing the underlying problem, as I said. And there could be others as well, because usually a cancer diagnosis doesn't happen in a vacuum. There's so many other things and moving pieces that happen. Then there's the lack of empathy, moral compass of the person leading the meditation. suppressing healthy remorse, healthy guilt, healthy, stress, if you may, in the
Mhm.
sense, like you
Yeah.
said, something important is at stake.
Yeah.
So those are all things that there are books out there, The Dark Side of Meditation and Mindfulness, that you can read. But so
Yeah.
life with so take this with a grain of
Each
salt.
its own.
There is a context to our life, and
Yeah.
be kind, be gentle,
Yeah.
and try to reach, if you are looking for someone to guide you through the process of mindfulness or meditation, it's important to identify people that they know what they're talking about, and they're also sensitive with respect to the context in which our lives are being run.
Yeah. Yeah. So each to his own was what I would say. I think the vast majority of people could practice a more simple technique and get benefit from it. And especially, I would always say, like, how do you feel an hour later or 3 hours later or the next day? Does it help you sleep? You have more energy or you're more calm. So you just kind of test it within yourself. But I'm totally with you. So loving kindness meditation, I think, is also can be very, very positive for people. The idea is that we can actually look to develop towards the kind of these compassionate statements towards ourselves and towards others. And again, we're not denying reality. It's just the truth is, if you say an affirmation, it can make you actually feel better. So, and so it's active. You're kind of building a kind of a sense of where you want to work towards. And when you're in that kind of more compassionate state, there is a neurocircuitry to compassion, right? And typically it's hard to be angry, upset, fearful, and at the same time compassionate towards other people. So it's this kind of flipping back and forth. And so practicing being more compassionate towards yourself and others is, generally speaking, very helpful. And maybe we should just take through a Ho'oponopono in like
of course.
3 minutes. Yeah.
The Ho'oponopono, the Hawaiian art of reconciliation and forgiveness. The Hawaiians have such a beautiful, beautiful process of walking one through when we're really hanged up on something that is very painful to us. Say, for instance, somebody did us wrong or ignored how we felt, or distance themselves from us because we got a diagnosis and they really don't know how to cope with it. And that happens, actually. Yeah. And so they would say things like, they would ask you to place your hand on your heart, and we can try this right now. Try to bring to mind someone that perhaps has distanced themselves from you, or maybe they graduated the relationship, they moved on, and maybe you haven't quite. Bring them to mind and say, and really mean it. Really mean it. Say to them, I'm sorry. Please forgive me. Thank you. I love you. I'll say it again. I'm sorry. Please forgive me. And mean it. I'm sorry. Please forgive me. Thank you. I love you. And then to yourself say, and really mean it. I'm sorry. Please forgive me. Thank you. I love you. And then to the other person say, may you be happy. And mean it. May you be happy. May you be healthy. May you be safe. And then to yourself say, may you be happy. Yeah? May you be healthy. May you be safe.
That's beautiful. I mean, it's a little bit of a mind bend for me, but it really actually makes me feel really good, really.
Because it almost feels like a betrayal when you say
Yeah,
to
I
someone
know,
that you think of.
Yeah, they
but the
have me
moment
wrong.
you turn that into yourself, there's something profound that happens. You see that? You feel that? Huh?
I do.
I love their practice. It works every time, like magic. Yeah. Something happens. It's not like, I replace a wrong with a right.
No, we're not saying that.
But it releases something in here, so I don't have to drink that poison of resentment, of grievance, and hope that they're going to die from it, because they're not going to die from it. I'm going to die from it. And when I do this, I feel I can still feel it's like I'm going from the emotional brain into the frontal lobe.
Yeah.
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 Into the front. That means I will still act with integrity. I'll do the right thing, but I don't have to do it from a place of vengeance. I don't have to do it from a place of battle.
Yeah.
And I do it from a place of centeredness and think, do I really need to do this? Is this the right thing to do? You do whatever is right.
Right. Yeah. Still making good decisions, setting boundaries. So the benefit of that is the anterior cingulate cortex. The insula is how you feel. Interestingly, how you perceive other people's emotions is also related to what you perceive within your own body. So it's the mirror neurons there. Hormonal shifts. We've been talking about the different hormones within the brain. Oxytocin, which is anti-inflammatory. Less cortisol, less stress, less anxiety. The vagus nerve is that main nerve that goes to our gut. When the vagus nerve is at a more relaxed state, it's sending that signal up to the brain so we can be more calm ourselves, less fear, and less about the me movie, like always like what's in it for me scenario, and more like just being in the present moment, being able to love and connect more easily. So doing that. And I feel that. I feel like, oh, that just makes me feel good. And the better version of me is coming out and being the more loving person. I just want to quickly mention there's a transcendental meditation based out of like a spiritual group, and that they would have certain energies and they would repeat a word or a sound like Om to it, and it has its own kind of set of dogma, et cetera, et cetera. And that's been proven to create that deep relaxation.
Absolutely.
Yeah.
That's why we have
Less
to be
stress.
mindful of our words. Words are very powerful because of the vibration that comes. And you see all sorts of, you can take a black surface and approach sound to it, and you'll see it change forms when you do that. You can now, there are certain devices you can put on plants and you can hear their vibration, like a
Wow.
music almost coming out of it. So yeah, that's very powerful. The
Yes.
sound, and especially making community, making one
Yes.
and sound.
Yes.
Very powerful.
Yeah.
Just as breath, tomorrow we'll be doing that. There's a planet, right?
Yeah.
There's this International Day of Breathing, and you can actually tap into a certain time where you can actually do this kind of breathing with everybody all over the world. It's very powerful stuff. Very
Love it.
powerful.
We only have a couple minutes left.
All right. So
And
wrap things up.
in the deconstructive
Meditation.
I mean, it's this puppeteer versus puppet.
Yeah.
Am I more the observer consciousness or am I more the personality type thing?
Yeah, it's like saying, I'm not a nervous wreck. No, there are terrible things happening right now in my environment. I am a center of full consciousness and I belong to it just like everybody else. I'm entitled to it just like everybody else. So deconstructing that negative self or negative perception of self to admittance that we're actually pure love, and that's our natural inheritance as opposed to some labels.
Agreed.
Egocentric or egoic rather.
Right.
Labels. Yeah.
And that ego state creates the projection or the perception of the world itself. And that, as you say, you can let go of some of those core beliefs that aren't helpful and be able to tap in to see a bigger perspective. And that for me is like mind training. You're essentially saying there may be truth and difficulty there, but I'm going to focus my love and my attention here, changing the game so you can win. And it is really a very powerful way to decrease stress, right? Because we're stressed or we're loving, it's hard to do both, to be in that truly loving state. And just to say that there is also visualization techniques. And I think I'm at this space now where I can share this with the Canadian Cancer Survivor Network as a little 10-minute piece that you could do. We'll maybe send that out with this. But essentially visualizing being in that more harmonious state. The brain doesn't know any difference between doing it and actually perceiving it. And so therefore you can have a profound relaxation response with that. So finishing off, if you're going to start a meditation practice, and I really highly recommend you try, see how it goes, test it out. You can start even with 1 or 2 minutes. That long, slow, smooth out breath, allow those shoulders to drop, right? And so then you slowly gain some experience over time. I like focusing on the breath, creates an anchor, and the breath is with us all day long. And it's normal and natural. As you can see, 30 years later, my mind is still going to chatter. That's normal. You don't have to, think that you're going to get into Zen state.
Yeah.
But it ultimately, I think it helps us in lots of different ways. Just to say, we have a program you can see in the bottom right-hand side of the slide, cancerpep.com, 6 months. It's led by a psychology professor scientist sitting beside me and myself. It's 182 days of emails and with daily videos and a very comprehensive curriculum that is body, mind, and even spirit, relationship teaching. You have the options of
live monthly video conferences.
Yes.
We've been doing them since 2019, every month. Didn't miss one.
Yeah. There's a buddy system, monthly video conferences, and it's proven. We know it improves quality of life, weight loss, cost savings. We would love you to join us. Come, cancerpep.com is the way to find it. And we
can do a free trial.
We actually have some free programs right now.
Yeah.
So colorectal cancer is free, lung cancer is free, kidney cancer is free, bladder cancer is free, CML, which is type of blood cancer, is free. So you can just reach out, info@cancerpep.com. Thank you again, Trevor, for this opportunity. We really love your group, and we are happy to finish off with an announcement, and then we'll turn off the recording and over to the Q&A.
Excellent. So thank you very much, everyone, for being at this presentation. And once again, Gabriela, Rob, thank you so much for your talk. It's always a pleasure, always fantastic. And we are definitely hoping to see you in the new year and hopefully on our podcast as well. This webinar has been made possible by grants from AbbVie, Amgen, Astellas, AstraZeneca, Eisai, Bristol Myers Squibb, Janssen, and Merck. Is because of their continued support for the entirety of the CC10 webinar series. We thank them for their commitment to our educational endeavors, and we could not have done it without them as well. We are officially finished our 2025 webinar season. I would like to thank everyone, the presenters, and those in the audience for making an extremely successful season with over 20 webinars in the books on a variety of topics about cancer and cancer journeys and everything about that. We are currently booking speakers for 2026, and we will look to return sometime in January. So once again, make sure you're subscribed to our emails at survivornet.ca/newsletters, and all of our webinars will be available at survivornet.ca/webinar or on CCSN's YouTube channel. And so with that, I will shut off the recording and go to the Q&A session. And for those who are now joining us, thank you and bye for now.